What is copper-2 sulfate? Copper-2 sulfate is a salt formed by treating copper oxide with sulfuric acid. It forms as a large, bright blue crystals containing 5 molecules of water and is known in commerce as blue vitriol. The anhydrous salt is produced by heating the hydrate to 150 degrees Celsius or 300 Fahrenheit. Other names of copper-2 sulfate are blue vitriol, bluestone, and chalcantite.
There are two types for properties of copper-2 sulfate, which is physical properties and chemical properties. There are many examples for physical properties, such as blue powder. Next, melting point for copper-2 sulfate are 110 Celsius and 560 Celsius if it pentahydrate. Lastly, density of copper-2 sulfate is 2.286 gram per centimeter volume. Three chemical properties are: first, reactivity. Copper-2 sulfate reacts with acids, bases, and reducing agents. It forms complex ions with ammonia and other ligands. Second, oxidizing agent. It can act as an oxidizing agent in some reactions, particularly in the presence of reducing agent. For the last one, hydrolysis. In water, copper-2 sulfate dissociates into cuprum ion and sulfate ion.
There are few uses of copper-2 sulfate. Firstly, as an additive for drugs and medicine, copper-2 sulfate is used in medicine for the purpose of preventing microbial growth, reduction of acidity, and stabilizing agents in pharmaceuticals such as antacids and cough syrups. Next, as a herbicide, copper-2 sulfate is used in agriculture to prevent growth of unwanted plants such as weeds among crops. They have high water contents which enable better absorption of copper ions. Lastly, for making paint and dyes, copper-2 sulfate is used as a building material because its high alkalinity makes it corrosive, thus reducing any corrosion occurring within the structure.
What is medicine? Medicine is the science and practice of caring for patients, managing the diagnosis, treatment, palliation of their disease, and promoting their health. Medicine involves various specialties like internal medicine, surgery, and psychiatry, and it is practiced by professionals such as doctors, nurses, pharmacists, and therapists.
The advantages of copper sulfate in medicine.
Firstly, medical tests for anemia utilize CuSO4. As blood is added to CuSO4, it should sink unless the individual's blood being tested is anemic. Other than that, CuSO4 is added to the pool to eliminate the spread of athlete's foot and contagious disease as it inhibits bacterial growth such as E. coli. Lastly, CuSO4 is diluted in water to treat aquarium fish for parasitic infection. It controls invasive aquatic plants growing near public water.
Precautions: avoid skin and eye contact. Copper sulfate can cause irritation or burns in contact with skin or eyes. Always wear protective gloves, goggles, and appropriate clothing. Ingestion risk: copper sulfate is toxic if ingested, leading to gastrointestinal issues such as nausea, vomiting, and stomach pain. Avoid eating or drinking near the chemical. Environmental hazards: copper sulfate is harmful to aquatic life and ecosystems. Avoid spills and dispose of it properly as per local regulations.